It's UofL Today on 93.9 The Ville. Here's your host, Mark Hebert.
Greetings and welcome to UofL Today with Mark Hebert on 93.9 The Ville. We're so glad you're joining us for the next half hour or so. Got some interesting guests coming up, and I hope you'll be sticking around by the end of the program to learn about UofL, all the things going on in academics, research, great faculty members, and great students. So, in just a minute, we'll be talking with a UofL engineering professor about artificial intelligence, AI. A little later in the show, you'll be hearing about a program called Doctors and Lawyers for Kids. And what that is when a child from a poor family goes to see a doctor, oftentimes those kids or families need legal help as well. And UofL is partnering with lawyers to make that happen, and we'll tell you about it. We'll also hear from one of UofL's 14 Fulbright Scholars this year. But first, should we be worried about robots taking our jobs and taking over the world? Well, yeah, maybe. We should be a little concerned, according to Roman Yampolsky. He's a UofL engineering professor who's written a couple of books about artificial intelligence, and I interviewed him a couple of weeks ago. So what is artificial intelligence, and should we be scared of artificial intelligence?
Well, it's our attempt to teach machines to do what humans do. Whatever it is, doing research, writing books, playing games. Anything.
Writing books? Robots are going to write books for us?
We already have them writing articles for sports coverage.
Who? What? Yeah.
Google it. How hard is it, given the scores for a baseball game, to produce a story?
Okay, I got you.
Team names, it's quite possible. But we are getting to the point where everything will be possible. Anything a human can do and things which are beyond our capacity will be done by machines. So part of my research is figuring out how is it going to impact all of us in terms of employment, in terms of social interactions, but also security aspects of it, safety.
Well, we all see, the movies, 50 years or 100 years in the future where robots become essentially humans and go haywire and take over the world. Is that what we're looking at?
So the biggest problem with journalism is that you cannot do an interview on AI and not have a picture of Terminator show up in an article. You can say anything you want, like AI for education is very important, and there is clickbait title, robots will kill us all in Terminator. It's a guarantee, we know it, I don't expect anything else.
I fell right into it, man, didn't I? I didn't mention the Terminator specifically, but I fell right into the trap.
Well, this is radio. If it was a newspaper, you would.
Yeah, okay, I got you.
There is a good chance that some of it might happen. Obviously not as in movies, but the possibility of military drones, military robots becoming dangerous is obviously there. Also, any system in charge of stock market, nuclear power plants, electrical grid, if it goes into
haywire,
wrong direction, if it gets hacked, that's a lot of problems.
Okay. And so what have you found through your research? You're trying to, I think, project into the future and try and figure out what the impact might be in the future and how sophisticated these robots and other machinery trying to take on human characteristics is becoming. Is that correct?
That is correct.
I read? Okay.
Depends
so what have
on
you found?
How far in the future you want to go.
Okay.
Right now we are kind of okay. I mean, cybersecurity fails a lot, but we're still managing. As the systems become more intelligent, we have nothing. We have no working safety mechanisms, no ideas how to build them, and very few people actually working on it.
Really?
We have
That
thousands
scare you?
of people and billions of dollars invested in developing AI, almost zero compared to that budget trying to make sure it's safe and beneficial.
All right, we're talking with Roman Yampolsky, who's at the Speed School of Engineering. He's a professor there, and he works in the computer engineering department. Does that scare you that we don't have folks?
It should scare everyone. Think about it again. So you have systems which are as intelligent as a human, maybe more intelligent, with no common sense, no controls, controlling everything, controlling our nuclear arsenals, controlling our electrical grid, water plants, everything, airlines.
Okay, well, you asked me, or you said it depends how far out in the future you go. What do we have right now in terms of artificial intelligence, robots and machinery, essentially trying to think like humans or do jobs that humans do? Well, give me, for instance, of some of the
latest
things.
We have self-driving cars,
right?
And they are safer than people. They're very good. It's a question of logistics, getting them on the road, so that's done. We have 85% of stock trades done by machines. That's another standard. And pretty much anything where a repetitive pattern occurs, we can automate that. So if you're doing something over and over, that can be done. There is no question about it already. In the last year or two, we started to be really good at doing pattern recognition, recognizing images, sounds, speech, being able to label this type of data. So there is some amazing set of improvements we see, and it's only getting better.
I think while you're talking about security concerns and those types of things, I think the guy working at the Ford factory is worried that artificial intelligence will take his job of building the next Ford Explorer.
Absolutely.
Is that a legitimate concern?
The biggest one, and that's the first one we're going to see, economic impact, technological unemployment. Most jobs can be automated today. As long as it's financially beneficial, we'll do it. So when people say, hey, I want $15 per hour to work at McDonald's, that's going to backfire. They're going to replace you with an iPad and a robot. Mm-hmm. So don't ask for that. It's not good. But eventually we'll have all jobs automated. We mentioned journalism being one of them. Absolutely, I have no doubt. It's a question how soon. I have a paper where I talk about what is the hardest job to automate. Luckily, it's a computer scientist. I'm the last one to go. But
how about a guy that does a radio show?
That's trivial.
That's an easy one?
I mean, you have a standard list of questions. Tell me who you are. What is your book about? I mean, I can automate it in 5 minutes.
But can a computer play off whatever your answers are like we are right now?
We're starting to see amazing progress in that. Chatbots like Siri and others, yeah, they're really good at even making jokes back, and they have access to databases of funny things, not just one or two. So it's quite impressive what we see.
So what are some of the other jobs that are tough to automate in your mind? What is a list besides a computer engineer?
Anything where you have novelty all the time. It's not a pattern. So if you're doing somebody's taxes day in, day out, that's easy. But if you're inventing, if you have to come up with new solutions, that's really challenging for machines still. It's not something you can describe. If you cannot describe what you do every day to someone, then that's not something I can automate. If you can tell me, this is exactly what I do. At 10 o'clock, I'm going to be here, I can do it.
And, all right, and so we've got, what's happening right now. Maybe in 10 years or so, some of these many more jobs will be automated. Say 50 years from now, what do you foresee? Take out your crystal ball. What do you foresee in 50 years?
A lot of people predict that around 2045, maybe 2021, we'll start seeing machines get to human-level intelligence. At that point, they basically take over engineering and science work. So the process speeds up exponentially. At that point, you can't see beyond it. We're not smart enough to see what's happening, and it's happening too quickly for us to actually analyze it. That's what we call singularity point.
And in your two books, do you talk about how humankind can put the brakes on this a little bit and build in some something that can stop the robots from taking over, basically?
So I suggest putting some brakes in. In other areas of research, which is also exponential, we see that. So synthetic biology, we kind of said cloning may be dangerous. Let's not jump into that. Let's study it a little before we go that route. With software, people don't associate software with danger. They don't think it could be as bad as nuclear weapons. So there is no restrictions. There is no need for permissions, no review boards to develop any software I want. If somebody said, I'm going to create this AI to kill everyone, there is no reason for them not to do that. I mean, no one even checks that.
All right, well, let's be positive.
All right.
Let's be positive. AI in 40 years will do these good things for humanity. What are some of those things?
Amazing progress in science. So medicine, for example, I'm pretty sure will cure most diseases, if not all, including aging. Most people don't see aging as a disease. That will be cured, will live forever.
I don't want to live forever.
You do, you just don't realize it.
No, I don't want to live forever.
Why are you still around? Why didn't you kill yourself yesterday?
Well, I just have no desire to live any more than a few years.
But that's because...
not a few years from right now, but a few years, like few meaning like 80 or 90.
But think about it. You just happen to like the default. You happen exactly the lifespan you have, whatever, 80 years. If you lived before, it would be 30. If somebody said you want 90, 100, you wouldn't say no.
Yeah, but I got some health problems, Roman.
I just told you.
I don't want to live with them for another 50 years.
We'll cure all your problems.
Okay.
You'll be young and handsome.
Oh.
Science will be amazing.
Well, I'm already handsome. I'm just not young. You're
do
debating
our best.
that?
We'll do our best. Photoshop.
All right, so that's one thing. So you're going to have amazing advancements in healthcare. What else?
Virtual reality. It's possible to get to the point where you can tell whatever your simulation is real world or it's something in a computer. So that allows us to give everyone exactly the life you want. You can be in a universe where you are the one. Everything you want happens exactly the way you want it to happen. It's kind of powerful technology if you think about it.
All
So
right.
you might be quite miserable in real life, but in that dream world, you are the king.
So I can live in upstate New York, where I grew up in Rochester, where there's more than 100 inches of snow every year, and go into my virtual reality where I'm in the Bahamas, right? Is that what you're
Pretty
telling
much.
me?
I'm also from Rochester, so
Yeah, I know.
I
We've talked
understand what
about
you're
this.
talking about. Yeah.
So you know how that is. All right. Anything else that you foresee that's a good thing that will come from artificial intelligence in our lifetime?
It's possible we'll have some good impact on politics. So technology would allow
Well,
us.
we can use that.
That's why I'm mentioning it. It would allow us to better check what politicians are telling us, sometimes live. That's already starting to happen. Also, we can automate a lot of what they do, replace them. I don't know if it's necessarily a good thing long term, but some of the functions they perform, like taking bribes and all that, we can automate that and remove that possibly if we don't want that. Biases humans have, racist, sexist biases, that can be taken out. So.
Well, that's a good thing. All right. Well, what's your biggest fear as we kind of wrap up here? What's your biggest fear about AI and the things that you tell folks when you go make speeches and write books? What's your one thing that you're really concerned about?
Nobody is paying attention yet. We're starting to see it, but politicians are completely unaware. The issues they're debating are meaningless. Nobody should care about anything they talk about at the moment. It should be really about impact of technology in the next 20 years. It's going to completely change how we live, how we work, economy. All of it will be different, and no one in mainstream parties talks about that.
All right. Roman Yampolsky from the Speed School of Engineering. Always interesting stuff. Always good to talk to you.
Thank you for inviting me.
All right. Thanks, Roman. There is a program in Louisville called Doctors and Lawyers for Kids, and the University of Louisville has a role in the Doctors and Lawyers for Kids. And with me right now from the Legal Aid Society is Beth Robinson and Marion Morris, who's a professor in pediatrics at UofL. So welcome to both of you.
Thanks, Mark.
Thanks for being here.
Thank you.
Now, I'm going to have to distinguish between the voices before you saw it. Say, that's Beth talking here, okay? Well, let's talk about what this program is. What is it? What is Doctors and Lawyers for Kids?
Doctors and Lawyers for Kids is a medical legal partnership. So basically, we embed legal services in a clinical setting so that folks who are living in poverty can have better access to legal care, which in turn makes them live healthier lives.
That was Beth, by the way. So, Marion, what does that mean when you have legal services in a clinical setting? Does that mean when a kid comes to see you as a pediatrician, what happens?
So we screen them for all kinds of things throughout our conversation with them in our clinic. Sorry, I'm screwing this up. We talk about, what are they eating, where are they living, where do they go to school, and we ask them about their legal needs.
Okay.
Are they having any issues with their housing? Are they having problems with their schooling? Can they get the food stamps that they need and are entitled to? And then if they screen positive for those, what we term social determinants of health, we then refer them on to our legal partners. One example of where we would see this is if we have a kid with asthma, we can give them all the medications that they would need, but if they live in a home with mold and bugs, they won't get better. And so that is where our legal partners come in and have a role, and we would refer them on.
How many kids are we talking about that walk into your office and they have some problem that may need a lawyer to help them work through, or their parents may need a lawyer to help them work through?
Studies show somewhere between 1 in 4 and 1 in 6 kids who live in poverty have a legal need that could be addressed to help their health. We are working on improving our screening to help capture those kids.
All right. And Beth, how does that work then? Does Marion pick up the phone, call you, and say, hey, I got this kid down here, they got mold all over the house, and he's got these health problems, and I need you to help work through these with the landlord? How's that work?
Sometimes, if I'm in the clinic, I will actually meet with the family if they happen to be there in that moment. And that's a really good connection to make right off the bat. They see your face. They get to hear that advice on the spot. It's a very quick legal connection. But also we do take referrals, and so someone might send me this family's contact information, and I'll call them, talk through the problem with them, figure out what solution might help them best.
And how many folks are we talking about here? That
I would say
over
in
a
the
year, course of a year or so.
Well, it depends. In the last 2 months or so, we've had 40 cases
Oh, wow.
of various different types. So it fluctuates up and down. Some days you might not have a referral, and then some days you might have 5. So it just depends.
And how did this come together? How did the Legal Aid Society get together with UofL and the pediatricians to figure this out, that you need each other to work through these issues with kids?
It's my understanding that everyone was starting to learn a lot about medical legal partnerships all over the country, and the Louisville Bar Association approached the Legal Aid Society, and UofL got involved, and everyone saw where they might be able to help one another and really decrease the amount of folks who are falling through the cracks.
Okay. And is that pretty much what happened, Marion? And
Yes, it is, and we are now seeing how crucial it is for us to have a lawyer in our office. We don't want to practice medicine without a lawyer.
why? Just because there are these unmet needs of these poor folks that walk in and need some help? Is that?
Yeah, it's so frustrating to be trying to help a family, but they have these issues that you either can't help them with or don't know how to help them with. Their house is, falling apart and has the mold, or they're in school and they're not getting the services that they need to succeed. And as a doctor with very limited time to address all the medical complaints, we feel helpless to help the kids with these issues. So it's so great to have somebody just down the hall that we can talk to and who is versed in the law and can get these problems sorted out for them.
Beth, is this a thing that lawyers in Louisville are volunteering to do this, or how does this work?
Yeah, so on the full-time staff, we have just one lawyer, and that is me. And we have way more folks who need help than lawyers to give it on our staff. So we do rely on the Louisville Bar Association's pro bono consortium, which are just ordinary attorneys in a number of different fields of law who give their time completely free to help these families.
All right. Once again, we're talking with Beth Robinson from the Legal Aid Society and Marion Morris, who's a professor in pediatrics and a pediatrician at the University of Louisville. And we're talking about the program called Doctors and Lawyers for Kids, which is here in Louisville. Once it gets from the doctor to the lawyer in these cases, then what do you do? Do you then pursue legal action against, and who is a normal person or an entity that you would help these families work with?
Sure. Well, it just depends. One good example would be some of these housing folks that Marianne is talking about. If you have a child who's living in a home with just really egregious mold, there are some legal remedies that you can take, but what is even more helpful to the family is if you can just give the landlord a call and say, hey, I'm an attorney, I'm representing this person. We'd really like to resolve this amicably. Can we just make sure that this mold gets cleaned up? And then you don't have a situation when this person's getting evicted, they have an eviction on their record, they can't find new housing. It really nips the problem in the bud before you even have to get to a legal remedy. And then you have some more traditional cases that you do send through court and resolve in that manner as well.
I know, Marion, there's been a big issue over lead paint and lead in water, those kinds of things. How many cases have you seen, or have you seen any cases in Louisville where children have walked in with lead poisoning?
So we screen all of our 1-year-olds and typically 2-year-olds for lead. We get some cases that are elevated. It is not all that common that when we recheck them that they remain to be elevated. The health department does a great job going out to the homes and testing for lead and helping them sort through the issues that would put kids at risk, like chipped paint that the kids then eat, and that increases their lead. It is not that common at this point, but it's something that we screen for regularly and are on the lookout for because it can have long-term implications as to the kids' intelligence down the road.
All right, that's Dr. Marion Morris. So, Dr. Morris, also, this is going to be a little bit of a sensitive question, but I'm going to ask it anyways. What if mom walks in or dad walks in with a child, walks into your office, and you realize they've got an issue, but it's a parental issue. It's a safety issue for the child. Mm-hmm. What happens then?
Then we involve our colleagues from the CPS, the Child Protective Services, we call them from our office and help determine a plan of safety where we can make sure that that child is safe, whether it's going home with a relative or going to foster care, or oftentimes they will decide that the child is safe to go home with one or both of the parents.
So this is not something that would fall within the realm of this program. That's something that by law you have to contact CPS, correct?
Yes.
Okay.
Well, and I would say, when there is domestic violence going on in the home, that is something that really deeply affects the kids, and that is something that they can refer to us. As far as child abuse or neglect, they do tend to funnel that more towards CPS, but there are a lot of other things that can be going on in the home that are related to that between the parents that we absolutely take those cases.
That's what I was kind of getting at. Maybe not something as dramatic as child abuse, but the parents are, there's some emotional stuff going on, and you can tell from the kid that you're talking to that they've got some problems. So you do handle those cases; those get handed off.
Certainly, and I would say that the staff and the providers at UofL have been excellent in identifying when a situation like that is going on, and a lot of times those folks do fly under the radar for a while, and this is one of those scenarios where they're coming in for this medical appointment. You can capture this situation early and address it before anything really egregious has a chance to take place.
Well, as we wrap up here, is this a situation where beforehand they can contact you about this program, or is this simply a referral once they have to walk in the door first and get to the pediatrician's office, and then you go from there?
We do depend on the providers and the staff to refer cases to us. Legal Aid Society at large takes folks just walking in the door, but the idea behind this is to sort of intervene early and practice preventative law the way that the docs practice preventative medicine.
And so you're bringing healthcare and legal issues together. And again, you kind of stated it off the top, but what's the purpose of that? Why do you think that's a good thing for this community, that you're bringing those two things together?
The kids that we care for are in need of help in many different realms, and they oftentimes do not have access to a lawyer to solve the problems that they can't solve on their own. Necessarily in terms of their housing and their schooling, and if there's any domestic violence issues, these families don't always have a place to turn and cannot always afford a lawyer. So having these services readily available in a place that they go anyhow to obtain care for their children helps improve their child's health. And there are legal remedies to their children's medical problems that our medicine cannot always solve.
All right, very good. Dr. Marion Morris from the University of Louisville. She's a pediatrician. And Beth Robinson from Legal Aid Society. Thanks for coming on the program. Appreciate it. The University of Louisville has 14 prestigious Fulbright Scholars this year, and that ties our record from 2010 and 2011 when we also had 14. We're very proud of these recent graduates who are now headed all over the world to study, do research, and teach English. One of the Fulbrights is Mackenzie Flynn, and I interviewed her a few weeks ago. And with me now is Mackenzie Flynn, who is another of U of L's Fulbright Scholars. Welcome, Mackenzie.
Hi, thank you.
Thanks for doing this for U of L, and congratulations.
Thank you, I'm so excited.
All right, why don't you tell me, what is a Fulbright Scholar? For those who don't know, what are you?
So Fulbright was founded by J. William Fulbright. He was one of our U.S. senators, and he had this vision that students and recent graduates could be cultural ambassadors for other countries. And so he used some Department of State money, and he founded the Fulbright Scholarship. And that's kind of how it got kickstarted. Fulbrights can travel to over 100 different countries, and not only are we expected to be conducting research or teaching assistants in various countries, but we're supposed to be cultural ambassadors for America.
And just so folks who are listening, a Fulbright Scholar is a very exclusive club here. There are only, U of L has a lot of them, but there aren't that many in the United States that are college students. So where are you going? What country are you going to, and what are you doing?
I'm going to Kenya, and I'm going to be in the capital city of Nairobi for my 9 months of my Fulbright, and I actually have a Fulbright Fogarty Fellowship. So it's a little bit different. It's for professional students, and I'm a medical student here at the university. So I'm going to be conducting public health research, and I'm going to be working with pregnant women in the Nairobi area that have HIV. And we are conducting some research on a text messaging program to see if that will get women into their prenatal clinics, get them more health care and access to antiretroviral medicine. So hopefully we can prevent the transmission of HIV to their babies.
So this is a pretty far-reaching thing that you're doing. You're not only treating these women, as I understand it, but you'll also be doing some outreach, trying to get them to come into the hospital and get checked.
Yeah, definitely. And we'll be working with surrounding communities. I'll be helping to book their prenatal appointments, and I hope to also be doing some work in the hospital.
In Nairobi?
Yes.
How did you land on that? Why'd you apply for a Fulbright to Nairobi, Kenya?
So public health and global health is something that I have based my medical career on thus far, and I hope to continue for the rest of my career. So with that in mind, I seek out these types of opportunities. And I actually had won a Fulbright scholarship upon graduation from University of Louisville. I went to Turkey as an English teaching assistant. So I knew the Fulbright program, and I knew they had other programs, other types of scholarships. So I first learned about this scholarship over a year ago, and I had my sights set on this award and applying for this type of Fulbright because this is the kind of work I want to do with my career. I want to be an OBGYN, I want to work with women, and I want to stay in academia. So I hope to work with women who aren't as well off in the community.
What at the University of Louisville has helped you along this path?
So, first and foremost, the excellent undergraduate education that I received here, and the Fulbright, the first time that I received, that kind of pushed me into these academic circles that I would not have known about otherwise. And in the honors department, Dr. Patricia Condon, she's been so wonderful. And medical school, continuing that here, I've continued to reap the benefits of knowing the academic circles within the university. And I'm a part of the distinction in global health. It's a distinction track within the medical school. So it's a program that I am doing on the side for all 4 years of medical school. And we are taking courses and learning about malaria and other public health different topics in public health, and it's like an amazing way to see how I can take my career in medicine and apply it to public health.
Last question, what are you most looking forward to about this trip, and what are you maybe a little bit scared of on this trip?
I'm most looking forward to meeting the pregnant women and to being in their midst, to hearing their stories. I think that it's so touching, and I think those are the things I'll remember for the rest of my career. Meeting these women and talking with them, and hearing how they came to be in Nairobi, and what I'm most scared.
Or apprehensive, maybe.
Apprehensive. Well, I'm engaged to be married, and so my fiance and I are hoping he can come with me, and that's definitely something we're working out, but we don't know.
So you're going to be planning a wedding while you're in Kenya?
Yeah.
So how are you going to do that? Put your mom in charge, mom or dad or somebody in charge of planning the wedding for you?
Yeah, he's great too. We have such a great support system.
All right, Mackenzie Flynn, congratulations again.
Thank you.
And since about Fulbright Scholars, today's little tidbit about the University of Louisville, the Did You Know segment, features some numbers about the Fulbrights. Did you know that since 2003, the University of Louisville has had 103 Fulbright Scholars. That is more than all other Kentucky State public universities combined during that same time frame. So congratulations to all those former students at the University of Louisville who won Fulbright scholarships. You can find the podcast of these UofL Today with Mark Hebert shows on SoundCloud.com. You can also see some of the shows on Metro TV, which is the Louisville Government Access Channel in Louisville, Kentucky, as well as KET3 on Thursdays at 5 p.m. You can also see me every Monday morning around 9:30 or so on Great Day Live on WHAS TV with Terry Miners and Rachel Platt, bringing you a story about the University of Louisville. Thanks to you all for listening and watching, and go Cards.